everybody, it's Diane here at Bella Lay. Welcome to our coffee talk. Again, I want to introduce Miss Julia McRae, who is here joining us on our team at Bella Lay to really provide an amazing service here that I've been wanting to have to help people heal themselves from the inside out, because I do believe beauty starts from within. So we are going to be discussing our topic this month of inflammation and helping people understand what it is and how to decrease it. And Julia has a really neat, amazing approach. And so Julia, can you kind of tell our audience really almost a definition of what inflammation is and how it affects the body?
Sure, yeah. I think in a nutshell, inflammation is a protective response that the body provides for us when there's an initial trauma or an initial injury. And it is a protective mechanism that's actually very positive and very helpful and necessary for the body to heal. The problem with inflammation is when it's chronic. And it's chronic and it's acute because stressors are chronic and acute. And when inflammation is chronic, we start to see the body break down on a cellular level. We start to see oxidation of the cells, we see the body break down, and this is where we start to see chronic illness and the disease process begin. Basically, that's what inflammation is in a nutshell.
Yes, yep, it is. And I think the more and more we learn as providers, me as a nurse practitioner, you as a nutritionist, the core of most chronic diseases and the issues people have, whether it's cardiovascular, whether it's brain, whether it's gut, is inflammation. And there are ways to get inflammation down. So can you explain to our audience kind of your approach of how you help people to decrease the inflammation?
Yes, absolutely, absolutely. Inflammation isn't just a sudden event that has happened to you. Inflammation is a result of the perfect storm that has been brewing for some time. And whether your perfect storm is that you've had chronic stress with your work, chronic stress in relationships, or maybe you've had unresolved trauma that you've been carrying for years, or maybe you've even had a dramatic event such as an injury. That kind of stress is something that is the perfect storm for inflammation to continue in the body. And when inflammation is continuing in the body, we start to see your weakest link begin to break down. And for some people, that is gut issues. For other people, it could be joints. For other people, it could be cardiovascular issues. So we have to look at why we have the perfect storm. And even though 10 people could have the same bowel disease, it doesn't mean that their approach is the same, because they may not have the same stressors in their life. Some may come and they're already eating very well, but they're still having bowel flare-ups, and that's not fixing it. Maybe they need to start looking at the emotional physiological component, which is huge with stress, because most people are walking around today in what we call the can body chemistry. And the can body chemistry is cortisol, adrenaline, norepinephrine, right?
Yeah.
Norepinephrine. And when that happens and the body chemistry is constantly being flooded with these things, the inflammation does not stop. The inflammation increases, and people start to see it go to other areas of their body. So what we need to do is we need to get people out of the can, right, and get them into the dose. Happy hormones that are conducive to healing the body, reducing inflammation in the body. And sometimes we like to go in and we like to help people reduce that inflammation when they're in an acute flare-up, and that can be with the kinds of things that you offer here. IV infusion, supplementation, things that help people turn the corner quickly, but we want to give them tools that keep the inflammation gone for life, so that their body can heal.
Yes. Nice. It's not just a Band-Aid, right?
It's not just a Band-Aid. It's not just about come in and let me give you some supplements to take to fix it. It's a whole lifestyle approach. What we think, what we eat, how we move, how we love, how we're loved, everything is relative and important.
And you take a lot of time in your consults with patients to really explain this to them, don't they?
Yeah, because healing is a journey and it's a relationship. I can't help you if I don't know all of the things that are impacting your health. And it's usually not difficult. Most people come in and they're very ready to spill everything and put all the puzzle pieces out on the table and say, help me put this puzzle back together because it has fallen apart.
So can you just tell our audience maybe some of the symptoms that people come to you that you can kind of tell there's some sort of an inflammation or gut issue, that if this is some symptoms people are having, that they could call and schedule that with you?
Absolutely. Inflammation, like you said, can be anything from anxiety, depression, because we know that brain inflammation, that was certainly a big issue for me when I was recovering from biotoxin illness. People have extreme fatigue, they have lack of energy, they have insomnia, they are unable to either lose weight, they've totally halted losing weight, or they have a lot of abdominal symptoms, a lot of digestive symptoms. And we just sit down and get all their history, all their information, and everything from the time they were born, and sometimes even when they were in the womb, to today. And we look at everything, and we start the restoration process by, what is the greatest factor today that's impacting your health?
Yeah,
that's what we're going to start working on first.
That's great. That's great, and it's a journey. So,
it is.
Yeah, so that's great. So we have lots of things here that we can help get inflammation down, and we can also measure the amount of inflammation. So as we offer the functional medicine consults here with Dr. Moore. He's here on Thursdays, and then Julia is here on Mondays to really kind of put this holistic approach together. So if this is anything that is interesting to you and that you would like some help with, we are happy to have this service here at Bella. And thank you again, Julia, for joining us.
Thank you, Diane.